Doctor, I haven't been feeling well lately.
John walked into Dr. Smith's office, his face etched with worry, his voice heavy with concern. Dr. Smith responded, his demeanor calm and reassuring. John paused, trying to gather his thoughts.
Well, for the past few weeks, I have been experiencing these strange bouts of fever. It comes and goes, leaving me feeling drained and achy. On top of that, I've lost my appetite, and even the thought of food makes me nauseous. I've also noticed some night sweats and joint pain that just won't quit.
Dr. Smith listened attentively, nodding occasionally to show John he understood. Dr. Smith explained, it's an infection caused by bacteria called Brucella. These bacteria are typically found in animals like cattle, goats, and sheep. Humans can get infected through direct contact with infected animals or by consuming contaminated animal products, especially unpasteurized milk and cheese.
Brucellosis, that sounds serious. What are the common signs of this infection?
Dr. Smith calmly explained, the symptoms of brucellosis can vary from person to person. Some individuals might experience mild flu-like symptoms that resolve on their own. However, in other cases, the infection can lead to more serious complications. Dr. Smith continued, other common symptoms include muscle aches, joint pain, loss of appetite, weight loss, and fatigue.
Doctor, what happens if brucellosis is left untreated? Could it lead to any long-term problems?
Dr. Smith acknowledged, if left untreated, brucellosis can indeed lead to some serious complications. These can include chronic fatigue, recurring fever, arthritis, endocarditis, inflammation of the heart valves, and even neurological problems. Dr. Smith paused, allowing John to process the information. Dr. Smith assured, with prompt diagnosis and appropriate antibiotics, we can effectively manage the infection and prevent these complications.
So, what kind of treatment are we talking about, doctor? Will I need to be hospitalized?
Hospitalization is usually not required for brucellosis treatment, John, Dr. Smith reassured him. The mainstay of treatment is a combination of antibiotics, typically taken for several weeks to completely eradicate the bacteria. Dr. Smith continued, the specific antibiotics and duration of treatment will depend on the severity of your infection and your overall health. Rest assured, I will guide you through every step of the treatment plan. Section 6, towards recovery, diagnosis, and testing.
But doctor, how can you be sure that I have brucellosis? I've been feeling unwell for weeks, and the symptoms seem to match, but I need to be certain. Don't we need to run some tests to confirm the diagnosis? I want to make sure we're not missing anything important.
Absolutely, John, Dr. Smith agreed. It's crucial to have a definitive diagnosis before we proceed with any treatment plan. To confirm the diagnosis, we'll need to perform some blood tests. These tests are essential in identifying the presence of the Brucella bacteria or antibodies in your bloodstream. These tests will help us identify the presence of the Brucella bacteria or antibodies in your bloodstream. The lab will carefully analyze your blood samples to detect any signs of infection. Dr. Smith explained further, depending on your symptoms and medical history, we might also consider other tests, such as a bone marrow culture or imaging scans, to rule out other potential conditions. These additional tests can provide a more comprehensive view of your health. To rule out other potential conditions, we may need to look at your medical history in detail and consider imaging scans like X-rays or MRIs. These scans can help us see if there are any other underlying issues that might be causing your symptoms. It's important to have a thorough understanding of your health to ensure we provide the best possible care. The process of diagnosis and testing is a critical step towards recovery. By conducting these tests, we can gather the necessary information to make an informed decision about your treatment plan. It's a collaborative effort between you and your healthcare team to ensure the best outcomes. Remember, John, the goal is to get you back to good health. With accurate diagnosis and appropriate testing, we can develop a treatment plan tailored to your specific needs. Trust in the process, and know that we're here to support you every step of the way. As you leave the office today, take comfort in knowing that you're on the path to recovery. With the right diagnosis and treatment, you'll be back to feeling like yourself in no time. Thank you for trusting us with your care. Section 7, shielding yourself, preventive measures. While we await the test results, John, let's talk about some preventive measures, Dr. Smith said, shifting the focus. Preventing brucellosis primarily involves avoiding contact with infected animals and consuming only pasteurized dairy products. He continued, If your occupation exposes you to animals like farm workers or veterinarians, wearing protective clothing such as gloves and masks is crucial. Always remember to wash your hands thoroughly with soap and water after handling animals or their products. Section 8, a shared responsibility, doctor and patient collaboration.
This is a lot to take in, Doctor, John admitted, feeling slightly overwhelmed. He had just received a detailed explanation of his diagnosis and the treatment plan ahead. The information was crucial, but it was also a lot to process all at once. John felt a mix of emotions, fear, confusion, and a strong desire to get better. But I want to do everything I can to get better. John's determination was evident in his voice. He knew that his recovery would require effort and commitment, and he was ready to take on the challenge. He wanted to be proactive in his healthcare journey, understanding that his role was just as important as the doctor's.
I understand, John. Dr. Smith's voice was calm and reassuring. She knew that empathy and understanding were key in building a strong doctor-patient relationship. She wanted John to feel supported and heard, knowing that this would help him stay motivated and engaged in his treatment. It's perfectly normal to feel this way, Dr. Smith reassured him. Many patients feel overwhelmed when they first learn about their condition and the steps needed for recovery. It's a lot to take in, but it's important to remember that you are not alone in this. Remember, we're in this together. Dr. Smith emphasized the importance of teamwork. She wanted John to know that he had a whole team of healthcare professionals supporting him. This collaborative approach was designed to provide comprehensive care and ensure that all aspects of John's health were addressed. I'm here to answer all your questions and guide you through every step of the way. Dr. Smith encouraged John to ask questions and express any concerns he might have. She believed that open communication was essential for effective treatment. By addressing John's questions, she could help him feel more confident and informed about his care. It's a team effort, John. Dr. Smith reiterated the importance of collaboration. She wanted John to understand that his active participation was crucial for his recovery. By working together, they could develop a treatment plan that was tailored to his needs and preferences. Your honesty about your symptoms and medical history is crucial, Dr. Smith explained. Accurate information would help her make the best decisions for John's care. She encouraged him to be open and detailed about his experiences, as this would lead to more effective treatment. And I'm committed to providing you with the best possible care. Dr. Smith assured John of her dedication. She wanted him to know that she was fully invested in his well-being and would do everything in her power to help him achieve the best possible outcome. Together, they would navigate the challenges ahead and work towards a healthier future. Section 9. A relieved patient, embracing hope. In this chapter, we delve into the emotional journey of a patient who finds solace and optimism after a crucial consultation with his doctor.
John, feeling a sense of relief wash over him, nodded in agreement. "Thank you, doctor," he said, his voice filled with gratitude and a hint of newfound confidence. "I feel much better knowing that brucellosis is treatable," John continued, his eyes reflecting a mixture of relief and hope. The weight of uncertainty that had been pressing down on him for weeks seemed to lift. "And that there are things I can do to prevent it in the future," he added, as he glanced at the pamphlet the doctor had handed him. The information was empowering, giving him a sense of control over his health.
"That's the spirit, John," Dr. Smith smiled warmly, her eyes conveying reassurance and support. "Taking proactive steps is crucial, and you're already on the right path. Now, let's get those blood tests done, and we'll go from there," she said, her tone professional yet comforting. The process was straightforward, and John felt a sense of calm as the nurse prepared the necessary equipment. "Remember," Dr. Smith continued, "early diagnosis and treatment are key to a full recovery. The sooner we start, the better your chances of a complete and swift recovery." As John left Dr. Smith's office, he carried a newfound sense of hope. The consultation had not only provided him with a clear plan, but also instilled in him a belief that he could overcome this challenge. He felt a deep sense of gratitude for the doctor's patience and expertise. The way she had explained everything in detail, answering all his questions, had made a significant difference. He knew he had a journey ahead, one that would require diligence and perseverance. But the knowledge he had gained today was a powerful tool, and he felt more prepared to face the road ahead. John was determined to face it head-on, armed with knowledge and the unwavering support of his doctor. He felt a renewed sense of purpose and a drive to take control of his health. the supportive interaction with Dr. Smith had been a turning point. It wasn't just about the medical advice, it was about the human connection, the empathy, and the encouragement that had made all the difference. Over the next few days, John immersed himself in learning more about brucellosis. He read articles, watched videos, and joined online forums where he could connect with others who had gone through similar experiences. He set reminders on his phone to take his medication on time and organized his schedule to include regular checkups and follow-ups with Dr. Smith. This proactive approach gave him a sense of control and responsibility. John also shared his journey with his family, who offered their unwavering support. Their encouragement and understanding provided an additional layer of strength, making him feel less alone in his battle. He began incorporating healthier habits into his daily routine, such as regular exercise and a balanced diet. These changes not only improved his physical health but also boosted his mental well-being. Attending a local support group for individuals with chronic illnesses became a part of his routine. Sharing his experiences and hearing others' stories helped him stay motivated and hopeful. John started keeping a journal to document his journey. Writing down his thoughts and progress allowed him to reflect on his growth and stay focused on his goals. With each passing day, John's confidence grew. He looked forward to the future with a positive outlook, knowing that he had the tools and support needed to overcome any obstacles. During his follow-up visits, Dr. Smith was pleased with his progress. They celebrated each milestone together, reinforcing the bond of trust and mutual respect that had developed between them. Embracing hope had transformed John's life. He found joy in everyday activities and pursued hobbies that brought him happiness. The journey was ongoing, but he faced it with a resilient spirit and an open heart. As he watched the sunset one evening, John felt a profound sense of peace. He had come a long way, and the future, once filled with uncertainty, now seemed bright and full of possibilities. Embracing hope had not only changed his outlook, but it also empowered him to take charge of his health and well-being. John's journey was a testament to the power of hope, knowledge, and unwavering support.